enough problems. And main centers like our vomiting center, our breathing center, heart, everything is being nicely controlled from brain stem. Brain stem is the most sensitive part of our body because our heart rhythm, our respiration is being nicely automated way, it's controlled from brain stem. Any pressure here, space occupying lesion inside the posterior cranial fossa, small tumors in the posterior cranial fossa will create much more problems as compared to even double size in the anterior or posterior cranial fossa. And the neurosurgical procedures are far safe in the anterior and middle cranial fossa as compared to posterior fossa. So small tumors here, usually if these are indolently growing, very slowly growing over a span of decades, surgical procedures are usually postponed. Here we can see a yellowish mass that covers the superior vestibular nerve. It's the facial nerve. Acoustic neuromas are 8% of all the intracranial tumors, 80% in the CP angle. CP angle is posterior cranial fossa space in the anterior-most part of posterior cranial fossa, cerebellopontine angle. CP angle, this word is being used so commonly that cerebellopontine angle, this pyramidal space anterior to the pons and medulla and posterior to the petrous temporal bone. This is potential space to harbor abscess, aneurysms, tumors. 80% of the tumors in the CP angle are acoustic neuromas. Sometimes it could be epidermoid cyst, something like cholesteatoma. Sometimes it's abnormal vessel. Female are having little more incidence to have CP angle tumors as compared to male. 90% of these tumors are unilateral and 8% of all the intracranial tumors are in the CP angle in the form of acoustic neuromas. Most often, the nerve of origin is superior vestibular nerve. Inside the internal auditory meatus, vestibular nerve is bifurcated into superior and inferior. And mostly it is superior nerve which gives rise to acoustic neuroma. Second in common is inferior vestibular nerve. And lastly, most uncommonly, it's the cochlear nerve which may be affected. Macroscopically, it's a yellowish firm mass. It's encapsulated. It's a false capsule surrounding structure that are compressed against the tumor and makes it capsule-like appearance. Two histological patterns are very common, like reticular and fasciculated. Fasciculated and reticular pattern have been seen histologically on microscopic examination. Sometimes what happens, it is true for most of the tumors in human body, that things are going slowly. It is true for the thyroid, true for the intracranial space occupying lesions, that for 20 years, tumor didn't create any problem. But all of a sudden, there's abnormal vessels in the tumor that leads to hemorrhage. And overnight, the patient is having enough symptoms, total hearing loss, suddenly, total tinnitus, and patient can have raised intracranial pressure, severe headache, unable to even ataxia, unable to walk properly. So these symptoms suddenly can appear. So in tumors, sudden symptoms, even in indolent tumors, slow growing tumors can happen. Here you can see a real lifetime picture. Live picture is a yellowish mass here, which you can see is compressing the facial nerve that is always anterosuperior. anterosuperiorly in the internal auditory meatus. Again, you can see a yellowish mass exactly inside the internal auditory meatus. Normal progression of the disease, if we don't disturb the tumor or don't treat it, how it will expand. The nerve expands hugely laterally and press against the contents of internal auditory meatus. There are two main contents: vestibular nerve, vestibulocochlear nerve, and the facial nerve. And it keep on expanding towards the cerebellopontine angle, and it can occupy the whole space. And once it reaches 2.5 centimeter, it not only presses 5th and 6th nerve, 9th and 10th glossopharyngeal and vagus nerve is also affected, pressed. And if things are going on, lastly, it occupies the whole space of CP angle, and it presses against pons and medulla. Aqueduct, the central channel for channelization of CSF, is pressed, blocked. Even fourth ventricle is totally shifted, and it leads to raised pressure inside the posterior cranial fossa, leading to hydrocephalus, herniation, coning of brain stem. And that is the most serious situation in the last stage. There are various staging systems, and the most simple being used is stage 1 up to 10 centimeter, stage 2 up to 20 centimeter, and 3.5 centimeter. And in 3.5 centimeter or more, it certainly end up with the life-threatening situation: raised intracranial pressure, coning, herniation of brain stem into the spinal cord. These schwannomas usually originate from vestibular nerve. Mostly it is the superior vestibular nerve that's affected, and slowly it goes from internal auditory meatus to the CP angle. And my colleagues, is the pons, is the interior surface of the cerebellum, is the petus temporal bone, and this pyramidal space is called cerebellopontine angle. It originates from internal auditory meatus, and slowly it goes postromedially in the CP angle. And in last stage is presses against pons and cerebellum, and even fourth ventricle is totally displaced. Most common symptoms are hearing loss, slow hearing loss, gradual slow hearing loss, unilateral in 80% of individuals. Rarely it can be bilateral, patient is having multiple endocrine neoplasias, and it is one component, acoustic neuroma. If you see so many skin lesions on human body, and their neurofibromatosis, and that is the main association in such patients. Bilateral disease, bilateral acoustic neuroma is common. Most commonly, prototype patients, most common patients will present unilateral hearing loss, tinnitus, abnormal ringing in the ear, and very uncommonly, patient can have vertigo. But uncommonly, patient can present with sudden deafness, sudden vertigo, sudden imbalance if there's hemorrhage or transformation of the benign tumor into malignancy. That's very uncommon. Discomfort, pressure in and around the mastoid process and ear can be an uncommon symptom. And patient can have some numbness, paresthesia, tingling sensations, and most often foreign body sensation in the eye. Corneal reflex is absent. And if you see inside the ear, most often, quite often, the ear is absolutely unremarkable. Normal ear canal, very good tympanic membrane, hardly you can see through semi-transparent eardrum. There is nothing abnormal visible in the middle ear. Cone of light, posterior part, everything is fine. If we find something here, blush, that's flamingo flush, that is called ectodermal otosclerosis. Among signs, normal ENT examination is usually unremarkable. Tuning fork test shows ipsilateral, unilateral, sensorineural hearing loss. A patient saying heaviness here, fullness here, hearing loss here is a sensorineural hearing loss that is picked on tuning fork, Rainey's test and Weber's test. Patient is in late stage, unable to walk properly. There is dimness of vision. Vision is disturbed. There is diplopia. Corneal reflex is absent. Facial nerve may be impaired. Facial paresis could be the first visible symptom. Foreign body sensation in the eye could be a late symptom. So, if we go through electrogustometry, eye becomes dry, secretions in the eye are Schirmer test is being used for that. Pure-tone audiometry shows hearing loss, that's sensory. Electronystagmography can be conducted, absence of caloric response in that particular ear. MRI and CT scan can help to pick the size of, exact size of the lesion can be picked with a CT scan or MRI. But MRI is far superior as compared to CT scan in all these patients. And we should know gadolinium is contrast being used for MRI. Brainstem evoked response audiometry shows there is delayed responses in that particular ear, that affected ear. Pure-tone audiometry, it may be asked sometimes. Here, the frequency is increased, and here the decibel intensity of the hearing is increased. It's usually high frequency hearing loss, sensorineural hearing loss in all affected ears. Here we can see space occupying gleam, nicely seen with a contrast. That's an acoustic neuroma. This MRI, bones are missing here. It is usually asked on such visuals. There's a CT scan picture or MRI. In CT scan, bones are nicely visible. Here the bone is absolutely absent. Here you can see a big size acoustic neuroma visible at CP angle, anterior to the cerebellum, anterolateral to the pons. Among differential diagnosis other than acoustic neuroma, uncommonly patient can have meningioma, facial nerve neuroma, congenital cholesteatoma. Patient can have aneurysm or abnormal loop of vessel, basilar artery or one of its branches, cerebellar tumors can present similarly. What is the treatment? As the tumor grows very slowly, the most important thing we have to share with the patient is assurance. We have to tell the patient what is really asked time and again counseling. How we counsel such a patient having acoustic neuroma. We have to tell very clearly space occupying gleam. It may create problem after 10 years, 20 years, 30 years. 6 months, 1 year, strong follow-up is mandatory. Not only clinical assessment is required, MRI, every time we have to check it with the MRI that's growing, is indolent or it's a static growth. It's very slowly growing over a span of 10 years it has only grown to a 3 millimeter, it's better to wait and see. No treatment, only strict follow-up, very close follow-up, watchful follow-up is required in all these patients. It's the gold standard treatment all over the body. If the patient we have seen just 30 years old, maybe we'll treat the patient rather than wait and see. You will see another patient who is 70 years old and we find just 3 millimeter acoustic neuroma. It's much better, no treatment should be offered, only follow-up is good enough. After 50 or 60 years, because tumor give enough time yet to wait and see and have a good time. So it's slow growing. In middle age, especially old age patients, it's better to ask, wait and see rather than for active surgical treatment. Surgical treatment is the mainstay, certainly, but posterior cranial fossa approach, surgery inside the posterior cranium is very, very hazardous. It's having a lot of, even at present, stereotactic surgeries, very fine surgeries, endoscopic surgeries. Morbidity and mortality is very high in all surgeries on the posterior cranial fossa. But in a young patient, it's better to take risk. There are 4 different approaches. And last treatment, that is in the form of radiation therapy. It stops the rapid growth. Sometimes it allows the tumor to involute, shrinkage, or total disappearance of tumor. Radiotherapy is applied in different forms, and you will listen various surgical procedures. Middle fossa approach, that is safest procedure for small tumors. Translabyrinthine approach, if the patient is having no hearing in that ear, one can go through translabyrinthine, but it's useful only if the tumor is confined inside the internal auditory meatus. If the tumor has gone exactly in the CP angle, these 2 approaches may not be sufficient enough. Then the posterior fossa approach or with or without lateral approach is always recommended. Radiation therapy inside the cranium is being used through gamma knife, X knife, cyber knife, or teleradiotherapy. This is almost the same, but having specification of computer with enough gadget refinement, it can, in a stereotactic way, the smallest space only which harbors a tumor, which have the tumor, is ablated, is evaporated without much damage to the adjacent normal structures of the brain. That's the refinement of these gamma knives, X knives, and the most particular type is cyber knife. Long-term follow-up in all these patients with or without surgery, with or without gamma knife is very useful. It's a slow-growing tumor, mostly in elderly patients. There's no need of active treatment. In young patients, in middle-aged, one can think seriously about surgery or gamma knife. Gamma knife and radiation is more effective in tumors which are with sizes less than 2 centimeters. If size is small, radiation therapy is always very useful. If tumor size is large, so radiation therapy may or may not work at all. So it may be adjuvant therapy, helpful therapy, but the mainstay goes to the surgical treatment if the tumor is already large enough. Follow-up, long-term follow-up with the use of various gadgets like BERA and most specifically CT scan and especially MRI in our ages is far superior to think about its follow-up. The second topic, my dear colleague, is noise-induced hearing loss. Ears and eyes are the 2 beautiful structures, nicely designed for very special senses. We can hear anything we like, and sometimes noise outside, inside your house, outside your house, your home is so disturbing for you, which you don't like to hear. But if the intensity of the sound is more than 95 decibel, it certainly leads to damage inside the ear. Sometimes noise is associated with blasts, bomb blasts, various different patakas, even firearms, and heavy exposure of such thing, a heavy sound, can lead to rupture of eardrum, fracture of ossicles, CSF leak, tears in the regional or basilar membrane, the whole cochlea is disrupted. All these direct head injuries or blast injuries or very heavy sounds are so notorious for this very special sensory organ. So, civilized people speak little, they only smile. So please take care of your smile. People like to see you happy, especially your parents, especially your loved one want to see you smiling and smiling like the small kid. And if you want to speak, sometimes your small whisper may be so strong rather than shouting for something, by your parents, from teachers, from anywhere. So your smile works more strongly, and your good positive gestures contributes a lot in positivity of society, at home, at Allama Iqbal Medical College, in Jinnah Hospital, and in ovals. So please take care of your smiles. We should just have smile most of the time, mostly try to whisper. If you just walk through corridors of University of Pennsylvania, Penn Medicine, hardly people are speaking loudly. Here we'll speak, and mostly meaningless. So please, we should take care of our words, especially with our close people, which really want to see you a very dominant man and beautiful girl. So please, we'll go through quickly. Acoustic trauma, heavy exposure of noise to the special sensory organ. If it's too loud, it can have permanent damage. It can't have transient threshold shift. All sounds less than 80 decibel, even after long exposure, prolonged exposure, long-term exposure, will not damage much. Mostly we speak, and right now I'm speaking at about 30 or 35 decibel. It is sufficient enough. But once you are talking with your senior, your parents, your elders, your voice should be just little, just whisper, but your smile should be very strong so that your every word is touching the heart. If we shout, it's mostly repellent. Your voice is having counter irritation. You don't solve the problems, you are adding your own misery. So it's better to be smiling, speak little, but with a good smile. So there's a big difference between walk and catwalk. Speaking good and speaking not good makes a very big change. My dear colleagues, noise trauma can lead to physiological change. The function of the cochlea is hampered. But the normal structures like hair cells, hair sensory cells inside the organ of corti are regional membrane, basilar membrane, everything, tympanic membrane is fine. But it could be so high in tone, it could be like explosive air pressure in the form of blasts that certainly leads to disruption of eardrum, dislocation of ossicles, fracture of ossicles, tears in the basilar membrane, Reissner membrane, hair cells are manifold disrupted. This happens. I can recall one very senior clerk in Allama Iqbal Medical College campus. He usually used to come to me for more than 10 years. He was having very severe hearing loss on right side and tinnitus. He's having history of exposure to pataha in some friend's wedding party. He says कि मैं गलती से चला गया जी, तो किसी उल्लू के कान ने मेरे बिल्कुल कान के पास आके पटाखा चला दिया. But from that time onwards, कहता जी मैं फौरन घर वापस आया, मुझे उस कान से सुनाई नहीं दे रहा था. और now 10 years has passed. That ear is totally damaged and he is having continuous abnormal sound called tinnitus in that right ear. It's a permanent damage. Medical science hardly can add anything, can help to have relief from this misery. So किसी की शादी पे बहुत ज़्यादा एक्टिव होने की ज़रूरत नहीं है, especially जहाँ पे firearms, blast, पटाखे हों, तो you just remain far away from such nice enjoyments. Otherwise, you may end up with a big misery. Effects of noise trauma. Factors affecting the damage. If the frequency of the noise is less than 3 kilohertz, it's more damaging. 2 to 3 kilohertz frequency is more damaging. If the intensity is more than 90-95 decibel, it is always damaging to the cochlea. Continuous exposure leads to more damage. If there are gaps, there are enough healing time, it is less damaging. If the patient is already having some viral disease, mumps and measles, as we said already, mumps, measles, influenza,
just 5 minutes left.
Cytomegalovirus can have already done something wrong in your childhood. So once upon a time, you must get your ears checked. If you're having normal hearing, 90% normal hearing, or just 80% normal hearing, gauges can check it. Noise measurement. There are different meters, sound pressure level meter. Name of the same is sound level meter. These are present. ये incorporate होने चाहिए हमारे शहरों में, so that at chalks, at various sensitive parts where there are more sound, bus stops and airports, one can check the meter level के 90-95 cross तो नहीं हो रहा. So sound level meter or sound pressure level meter exactly beep देता है कि यहाँ पे काम गलत हो रहा है, sound बहुत ज़्यादा है, do something. And if one wears the small meter, it's like dosimeter. Dosimeter भी words ठीक है, dosimeter भी ठीक है. Noise dosimeter, it's incorporated at such places like constables, like drivers, ताकि उनका exposure ज़्यादा ना हो. Exposure, people working in industries should also wear noise dosimeter so that the level is not crossed towards the damaging level. Symptoms are very simple. Patient is having distorted or weak hearing. Patient can have tinnitus. Audiogram usually shows mostly the damage with the high sound noise induced. Maximum is 4 kilohertz. 4 kilohertz damage mean acoustic neuroma, acoustic damage or high sound exposure damage. We can see audiograms like this where maximum damage we'll see at 4 kilohertz. Artillery के लोग, drivers, industries में जो expose होते हैं, mostly here is. So one should use ear plugs, ear muffs, canal caps. These are available and this is mandatory to use in drivers, in constables, on chalks, especially in industries where sound is too heavy. Combination of ear muffs and ear plugs works very well. Treatment is very simple. It's totally preventable disease. Noise causes so much damage above 90 decibel. avoid hazardous, noisy environment, especially a profound check for drivers, rickshaw drivers, bus stands, especially at industries, it's our duty. If you find such a patient having immediate exposure, absolute rest, vasodilators, antioxidants, and neurotonics may work very well. So acoustic neuroma, which is slow-growing tumor, in elderly patients, no treatment. In young patients, we can think seriously about gamma knife, X
2 मिनट
knife,
रह गए आपके
cyber knife.
तक.
If the patient, thank you very much. I have just few words to be shared. If we have acoustic neuroma in the middle age and the tumor size is small, we'll certainly prefer to go for radiation therapy in the form of gamma knife or cyber knife. If the tumor size is more than 10 centimeter, 20 centimeter, certainly surgery can help a lot. So we can add gamma knife with surgery. In noise-induced hearing loss, by all means, sound pressure, sound level meters should be incorporated everywhere, and dosimeters, sound dosimeters should be used in industries, people working in industries, at loud places like constables, like drivers, they must use sound dosimeters. It should be incorporated in our law so that we can avoid hearing loss. किसी की शादी पे जाके बहुत ज़्यादा एक्टिव होने की ज़रूरत नहीं है. Keep up your smile, keep up your enjoyment, but stay away from firearms, especially loud patakhas and firearm blasts and various places where you may be exposed to high sounds. And earplugs, earmuffs may be useful if you are likely to go to such places. Thank you very much. Have a very good time. If you have any query, any question, I'll be very happy if you can share on the phone given already. If you have missed that, 0300 8407 313. 8407 313. You can only message. You can just have text message. I'll reply to you. I'll also share your question in the next lecture. Have a very good time. Give maximum time your parents because they are supreme in your life, and let us make our voices very beautiful, smiling, only whisper, then your every word will be heart-touching. We are just waiting for the good days. Inshallah, we'll see soon in the classes. Thank you very much. May God bless you.